This podcast is about storytelling. I am your host, Dr. Mijiza Sanchez-Guzman, Associate Dean of the Office of Medical Student Affairs and the founder of the First Generation Mentorship Program at Stanford Medicine, and I am proud to be first generation. Many of us are the first in our families to accomplish living the dream. Being the first means different things to different people. Join me now on a journey as we share our stories about how we've navigated being first generation in academic medicine. I will have the honor and pleasure of interviewing first generation clinicians, leaders, mentors, students, faculty, and researchers as they share their lived experiences of being the first. I hope these stories will inspire the next generation of leaders in health sciences. Dr. Bonnie Maldonado is a distinguished physician and academic leader known for her expertise in pediatric infectious disease and public health. She currently serves as the chief of the Division of Pediatric Infectious Diseases at Stanford University School of Medicine. Dr. Maldonado is recognized for her commitment to addressing health disparities and her innovative research in vaccine development and epidemiology. A passionate advocate for children's health, she has played a pivotal role in shaping policies on infectious disease prevention at the national and global levels. In addition, Dr. Maldonado is actively involved in mentoring the next generation of medical professionals, fostering an inclusive environment in the medical community. Dr. Maldonado is also the Senior Associate Dean for Faculty Development and Diversity. It's my pleasure to welcome Bonnie Maldonado. Thank you for being with us. So, Bonnie, would you share a bit about your background and what led you to the field of academic medicine at Stanford?
Yeah, thank you for inviting me to talk today. I really had not mapped out a path to academic medicine. I think it was a means to an end for me. I started off as a child really being very interested in science and asking lots of questions and research in my own fashion. And over time, I realized that I really continue to have that love of asking questions, thinking about research, ways to answer questions, especially in science, and that really led me to a career in academic medicine. And in the end, I think over the course of my career, I realized that the best path for me in terms of my interest and love of science, my love of working with people and helping communities thrive, was in an academic setting.
When did you first become aware of your first gen identity?
You know, I really never thought about it. It was something that it was just who I was. I grew up in a primarily blue collar Mexican American community in Southern California. And all of the kids I knew were very similar to me. We came from the same kind of background. Most of us grew up with families who had either immigrated to the United States or had been here for a long time, but celebrated their culture from different countries. And so we just grew up that way. And I think by that I mean celebrating my culture. I really didn't think about that being different from the American culture. It was my Mexican and American heritage that I felt very comfortable in. Wasn't until I got to college maybe that I started realizing there were other kids who had different backgrounds, but I wasn't really paying much attention to that. I think it became more acute in medical school, and then certainly as you go up the ladder, you start noticing the differences actually more than I did when I was younger, because I just had such a solid and secure feeling in my own community as I went forward, and as I got into the more narrowed fields where there were less people like me, that I started to realize how different my background was. So it was a gradual process. It took many, many years, actually.
Yeah, that's common. What are some of the barriers or challenges you faced as you pursued your career?
Well, I think the usual things, just trying to figure out what I wanted to do. I had a general idea of, again, my interest in science, my interest in community health, my interest uh, in learning and going to pursuing further education. But the big challenges I think really had to do with looking back, it was lack of mentorship and lack of information. I think I was pretty good, and I think most of us who've made it this far were pretty good at figuring things out on our own, or banding together with other people, peers. But looking back, I think what was probably the most difficult was really just not having anybody to help build that path to success, or path to areas that I thought were going to be exciting for me to pursue, or opportunities to explore areas that I didn't really have any access to. So really didn't have much of that. And that's interesting to me, eh, given that I went to an all girls private high school. And even there, we just didn't have access to anything that was really, I think, high level mentorship or counseling around what to do next. Might have been the sign of the times that I grew up in, but also the kind of community I grew up in. And I was also on the college track. I mean, we had a college track at my school, and it was pretty clear that the school wanted kids to go to college, but there was very little formal support, which is really surprising given, what we see now. So given that I had potentially a lot of benefits, there was very little substance to that. So I would say that's probably the hardest thing. I think cultural differences came up over time, but I surrounded myself with people who were supportive and in very similar backgrounds as I was. So I really didn't spend a lot of time, honestly, thinking about those things. I really just trying to overcome them. So, for
Mhm.
example, when I was an undergraduate at UCLA, I noticed that there really wasn't a lot of support for pre-medical uh, um, resources for underrepresented minorities. And so with some of my friends, I just started an organization. I wrote a grant to the university, and we started our own little Latinx pre-med society, and it's still going pretty strong now. So we just figured if it's not there, we'll just build it ourselves. So again, probably the people who made it through are people who are going to be resourceful and just do it on their own. So yeah, and we just figured it was another fun challenge, to build something exciting for ourselves.
I love that. If it's not there, build it.
Yeah.
What What do you wish you knew before entering the world of academic medicine?
Oh, I think just understanding how to build relationships with other people, and how to build networks. Those came over time. And now, of course, I have a very mature career, and I have lots of friends in different places around the world, and we collaborate and we have fun together. But that just wasn't part of my world early on, because those networks just didn't exist for me.
Can you say a little bit more about how you built those networks?
Oh, again, just, kind of sweat equity. Just do it. If it's not there, you figure it out. My family, again, working class family, very hardworking, just get the job done. If it's not there, you fix it, build it yourself, find a way to do it. And so I managed to, for example, when I um, started my career as an undergrad, I just took the classes that were really interesting to me. And I loved working with science, viruses, virology, immunology. Decided I wanted to go either get a PhD in molecular biology, or go to medical school, or do a master's in public health. And just chose medical school first because I thought that would be an opportunity to do all the things around science and taking care of people, and had a community at Stanford as a medical student. I have to say that was probably one of the most supportive times was in medical school, where we had a community of students who were very supportive of one another. In particular, the minority student programs and the minority student community was very supportive, and was really helpful for me. Um, but then, moving beyond that, again, lack of really understanding how to build resources. It was really great to learn how to see patients and take care of patients, but I wanted something more than that after, not just taking care of patients, but learning how to do research to prevent diseases. And that came later on, as a fellow, and then as a young faculty member. But again, just trying to reach out and find people. I do have to say that having a mentor would have been really helpful. And I did have a mentor later on. It wasn't until really I got to my faculty position that I really was able to build that mentorship opportunity. So I think those were the kinds of things that would have been helpful earlier on. And sometimes I look back and think, well, maybe I could have accomplished more or done better things or other things that might have been more interesting or as interesting. But I don't regret anything that I did. So I actually enjoyed my whole career pretty much was enjoyable. And of course, you have to work hard, and there were tough times, but I don't think that I regret anything I did. It just might have been easier if I had had more opportunities for support, like the kinds of things that you offer to the medical students and that I try to offer to the faculty here at Stanford.
Thank you for sharing that. What advice would you give to someone who's interested in pursuing a career in academic medicine?
Well, the first thing I would do is really seek out other people, either peers or senior people in a field. It doesn't have to be one field that you're interested in. It could just be somebody who you think might be aligned with your own interest, culture, sensitivities, and just ask them questions. Some people may turn you down, but just be persistent and find some one or more people who you can talk to and ask, how did you get where you are? Or I have questions about what I want to do. I think that's really the best way to start off, because if you're in this area and you're willing to work hard and learn, there are going to be people out there, and I think we still struggle to find ways to link people together so that they can have mentorship um, across a number of different scenarios. We're all very complex beings. We have very different parts of our lives. There's the personal part, the professional part, the social part, and other parts of us. And each of those may require different kinds of networks, but you may not network the same way in each of those areas. And building those relationships takes time, and also they need to be bi-directional. I think it's important to make sure that you have relationships that give back to the other person as well. So
Mm,
that's all complicated and it takes time, especially when you're trying to build a career and you want to be on a track. And honestly, academics is a fairly fast track. You're not given a lot of time for mistakes. And so building that track is as easily as possible is going to help you get through that process more quickly and actually more pleasantly as well.
mhm. How has being first generation shaped how you approached your career?
I think thinking about it more now than I did over the course of my life, it really has made a huge difference in what I chose. So I do research in global child health. I work in areas of the world where children don't have access to care or have very limited access to care. They may not have a lot of resources in their home life as well. And my work is really focused on trying to at least address one area of their lives, and that is infectious diseases, because I happen to love working with viruses and vaccines. So I can apply my love of science to helping people in parts of the world that may not have access. And I think growing up as a first gen person, I also spent a lot of time in Mexico growing up. I would go there in the summers to stay with my grandmother. And then I'd come back home to my parents for the school year. And so I got to see what other places look like, how people lived in other parts of the world. And I think it sensitized me pretty quickly and subconsciously, by the way, to the fact that not everybody has access to a lot of the things we have here in the US. And so it gave me that little bit of breadth of understanding that there's a big world to conquer out there, and there's a lot of inequities. And so we didn't call it health equity then, but I think that was something that I was always interested in based on what I had seen and outside of the US, and even within the some communities within the US that probably didn't have access to resources like others did.
Mhm. Do you believe your first generation status influenced your career choices and trajectory? And if so, in what ways? And you touched on this in your previous response.
Yeah, absolutely. I do think, in retrospect, of course, I didn't think about it consciously at the time, but I think serving the community was always really important to me. Part of that had to do with my parents. My parents also came to the U.S. from Mexico, and built what we would consider the American dream. They worked hard. They had a successful marriage and careers, and we were very happy growing up. And but they were always giving back to the community. They were always first to volunteer. We would go outside the US to donate items to people at convents and um, orphanages in the border towns. And so we were always doing things for others. That was something that my parents were really dedicated to. And even my mom in her later years, but I found out after she passed away that she did a lot of community service on her way home from work. She'd stop and do stuff, and we would never hear about it at home. So there's just a sense of giving and giving back to the community and sharing what you had. And I think that played a big role in my interest in community health. But one of the obstacles actually was really a bit ironic because at the time, the other minority members of the medical school community thought I was not dedicated enough to the community because I wanted to do research and become an academic. They said, well, if you really cared about your community, you would be a primary practitioner and go back to the community and serve them where they need you and not go into academics. And so I was a little surprised at that. I mean, honestly, I was more than a little surprised at that. Why do you think there's an either or? And I didn't feel that I wanted to give up my own personal interests. And I didn't think I had to, because I thought if I was doing work for the public good, for the common good, it would affect all of my communities, not just one community, but all communities. And I felt that that was a responsible way to use my own talents and skills. And so I was a little surprised at that. But again, like other things in my life, I just decided, well, you may think that, but you're not going to live my life for me. And I think that I can give back in other ways as well. Um, so anyway, yeah, I just think that community health was very important to me. And then expanding that vision of community as being a global community was really fun for me to discover as I went on in my career. After finishing medical school and going into my residency and my fellowship in pediatrics and infectious diseases, I was able to learn more about the global community, and especially through work that was being done at the Centers for Disease Control and Prevention at the time. I had contacts there, and I realized that I could learn more about these global efforts. And so I trained there and was able to understand that I could use my science and public health interests to really change communities elsewhere. So I do think that having that perspective of, we're not just isolated in our little zip code here, really helped me understand how I could take my own skills and talents and use them in other ways and still be have a fulfilling career where I was interested in the work that I was doing.
I love that story. It's about the polarity, right? Two things can be true at the same time, both and. How do you believe that we can make the field of academic medicine more inclusive and accessible for first generation folks?
Yeah, well, that's the never-ending question. I think we're always seeking for ways to eliminate disparities and to provide opportunities. I think it's something that I've been interested in my whole life. I started doing work tutoring kids in high school, and in college, I started programs to try to expose first gen or underrepresented kids from low income areas to the opportunity to go to college. I had a program at UCLA where we did that. We had a formal program where we brought kids in to try to teach them how they could start thinking about going to college. And so really looking at ways to improve opportunities for others has always been there. I think we've gotten much better about understanding how to reach out to communities But I also think there's still a lot of barriers because our economic disparities in this country have gotten worse, not better in some ways. And while we try to diversify and be more inclusive, I think we are still missing out on a lot of young talent that we just haven't been able to reach. And so I think in the end, it's all about doing the hard work of just finding those communities. I happen to do a lot of research in polio eradication, and the reason I bring it up is that one of the things that was done when we talked about polio eradication was reach every child, find the forgotten child, no child left behind, and we did that with billions of dollars of effort. We were able to go out and vaccinate kids all around the world, find every last child and vaccinate them against this disease. And so I think, in many ways, that's the same principle. If we want to reach every child to reach their potential, we have to find every one of those kids and find ways to reach out to them. So we know that we can do that. The question is, how do we do it? How do we reach out to people? And who's going to help us do that? And so I think that's a really big challenge for us, is to continue to reach out and find all the kids in the world. Not, obviously not each one of us, but to really build systems across the globe where we can really help all children reach their potential. And in this country, of course, where we live and want to bring these kids in, is really reach out to kids that may be forgotten, or people may have already written off, and to make sure that they get the opportunity to see what all their options are. I don't think everyone is going to go into academic medicine. I really don't think that's the point here. The point is to show children that there are options for academic medicine. There are technical programs that they can do that can support their interest in STEM, and other fields as well. So it's really just about trying to find kids and giving them opportunities to learn about career choices and life choices that will not only benefit them, but benefit other generations to come.
Mm-hmm. Bonnie, you've been an amazing mentor and supporter of our program. Can you think of any mentors that have been particularly influential in your career?
Yeah, absolutely. I have one particular mentor who has really been really important in my life. So this was a woman who was a faculty member here at Stanford when I was a medical student, and I was her first medical student when I did a rotation with her, and she was my first faculty member, and she was very young in her career, but she was just a wonderful, brilliant, and dedicated person, and really took time to spend with me and teach me not just about the work that we were doing, but also just um, general principles of how to behave, how to work in this environment. And so I met her early on as a medical student, and then over time, when I left Stanford to finish my training elsewhere, and then decided I was back in the area, I reached out to her again, and she said, "Oh yeah, I've been tracking your progress." And she said she offered me a position here at Stanford. And that's how I came to Stanford. Was I was looking at either public health opportunities at the state or national level, or I was thinking about an academic job. And when I talked to her, she said, "Wait a second, let me get back to you, because I think I may have some opportunities." Because I had asked her if I could come back and work in the clinic. And so she called me back a few days later. She said, "Would you be interested in a faculty position here, tenure track position at Stanford?" And it turns out that she had also been looking for an additional faculty member. So it was really just great timing, but also knowing the right person. So I came back to Stanford, and she was my division chief. And really, over the course of my whole career, she's just been very influential, really helping me figure out, little things like, now you should start thinking about writing this grant now, or here's who you should talk to about that particular project, and really just giving me the kind of advice that I really needed at a very high level. Again, not the day-to-day details, but more high level advice. It was really more strategic, and she's a brilliant strategist, and just really, I think literally I would not have had this career if it hadn't been for her. And of course, I always have to give credit to my parents for really being there all along the way and really not understanding exactly what it is I wanted to do or how to get there, but always being there to support me and make sure that I got the moral support from them and the emotional support that I needed to get through my different career interests.
Mm. How do you celebrate being first gen?
I think I just live it. I mean, I don't even know that I'm not being first gen. I think it's just in the way I think and the way I look around the world. It's who you are. I think it's really important, at least for me, not to deny who I am and to celebrate who I am on an ongoing basis. I think, um, I consider myself fortunate. I had a lot of opportunities given to me. Of course, I worked hard for them, but I also had those opportunities that maybe others might not have. And I just try to celebrate being first gen by offering other first gen people as many opportunities as they can have as well, so that we can really lift up others and make this world just a better place for all of these young people who really are looking for a chance to just better themselves and better the world.
Mm. Is there anything else that you'd like to share with our viewers?
Well, I don't want to sound like a Pollyanna because I can be pretty tough when I need to be. So I'm trying to just give you some high level stuff. Of course, on a day-to-day basis, you got to make some tough decisions. You have to say no. You have to, weed out, the some things that may not be, working for you. So it's not easy. I'm not saying it's easy, and I'm not saying it's always fun. And but I think if you develop uh, some confidence in yourself and your ability to make decisions, I think that goes a long way. Now, I will say the other thing you didn't ask me, which I get, is that, when you get older, and I am a little bit older than most people now, you start to look back and realize, I think I know more than a lot of other people just by the fact that I've been here long enough and I've learned a lot of lessons. And so as I went through my life, especially as a first gen, I doubted myself a lot. And there was definitely a lot of imposter syndrome going on. I don't want to minimize that at all, but I think everyone talks about that already. But I think as I got older, I was able to really think about um, the fact that uh, I should trust in my own judgment and trust in my abilities, just like others might do in themselves. And so, really learning how to do that is a lifelong job, I think, at least for me, it was. And especially being a first gen minority and woman, so you're constantly second guessing and third guessing yourself. And I think I've gotten a lot better about that over the years. I think at a certain point, I just said, I just put it out there. I mean, I think I have pretty good judgment and I have a lot to show for it. So if I have a feeling that might be different from other people, I have to be able to make that statement and justify it. And if it doesn't get accepted, that's fine. I've learned something. And if it does, then maybe that'll help the situation. So I don't mean to say that it's easy and it's fun all the time, but if you have people around, if you surround yourself with people that are like-minded and supportive, it goes a long way in helping you get through those tough times when you're trying to make decisions, when you don't really know what the next step might be. And one thing I tell a lot of the trainees and people that I mentor is that when you look back on a long career, it looks like a straight line, but it's never a straight line. In fact, there is no line. When you're looking forward, there's just lots of pathways you can take, and that's hard. And so it's great to look back and say, this is how I made the next step, but I could have had 20 other different pathways as well. And I might have been as happy or happier. But again, you pick the path, and then if it doesn't work for you, you pivot and you look for a different way. And the beauty of it is if you have that supportive group of people around you, that you can help, they can help you get through that, and you can help them, you can help each other get through the tough times and celebrate the fun times.
Okay, Bonnie, can we ask you some rapid fire questions?
Yeah, sure.
Okay, what are you reading right now?
Well, I usually read two or three things at a time. I think I have ADHD because I can never stick to one thing at a time. So I'm reading two or three books right now. And I don't like paper books anymore. Part of it is just environmental stuff, but also I just don't like have to kind of lug stuff around. So it's easy to put ebooks on your phone and I just like to carry them with me. So I'm reading, there's a guy named Mick Herron who writes a lot of MI5 British spy stuff. And it's not like the 007 stuff. It's like the old fashioned, grunt work that these, people do. And I kind of love that because it's like finding clues and trying to solve problems. So it's a series called Slow Horses. And I'm on the second book of that series. And it's just MI5, basically failures who are actually trying to redeem themselves in the spy world, and it's really kind of fun. So that's one book, one series, and the other book I'm reading is called Demons of Unrest, and that's by Eric Larson, and he's a pretty noted a kind of historical documentarian, I would say. And this book is about the time in the US between when Abraham Lincoln was elected and 5 months later, the start of the Civil War, and all the mistakes that happened and all the trauma that happened to get us from electing a known abolitionist president like Abraham Lincoln, and then the secession and the beginning of the Civil War and all of the things that happened there. So I'm in the middle of that as well.
I want to check those out. What is the last good movie you watched?
Oh, Conclave. Conclave was really good. It was about how to elect a new pope, and it was really done kind of like almost like a intrigue and spy and political work, and I kind of like that because everything is at the end of the day, everything is politics, and it was really good to see. Plus, they had some great actors in it. But I
Mhm.
also actually loved seeing Wicked. Wicked was really fun. Yeah, I
I
mean,
just saw that last weekend.
really fun. My two of my kids were athletes, and my third daughter was did not like sports. She was a theater kid. I'm not a theater person at all. I really had to learn how to love it. And through her and through my husband who loves theater also, I just got to love some theater, not all, but some of it. And Wicked was really great. And I think it was great to see all these young theater kids enjoy this movie. And it celebrates women and people of color in very interesting ways. And I think it does it in an entertaining way. So I just love that part of the movie.
Hmm.
And it was just fun.
It was a fun movie. Are you a coffee or a tea person?
Oh, decaf.
Oh, okay.
I don't like tea. I love coffee, but if I have it, you just don't want to be around me. So I drink decaf.
If you could live anywhere in the world, where would you live?
I love being in California in the Bay Area. I mean, where else would you want to live? This is the perfect place in the world. We've been spoiled. But if I had to have a place somewhere else, I'd probably want to spend time in London and
Mm.
Porto, Portugal.
Huh. Okay. What podcast, if any, are you listening to?
I tend to listen to podcasts. Well, I don't have a lot of time to listen to podcasts, and at night I tend to not want to listen to any more facts and figures. But what I do is when I go running, I'll listen to podcasts. So I usually just subscribe to Apple News and pull up whatever they kind of know. They've curated my interests. So mostly they're weird scientific stuff like about birds and bird language or fruit bats or the next pandemic, things like that. I don't like to listen to politics because I'm a news junkie already. So I do that in my regular time. I read 5 newspapers a day, so not cover to cover, but I just skim 5 newspapers a day. So usually when I want to have fun and listen to podcasts, I listen to fun sciency things or things about Taylor Swift or popular culture that I probably won't get anymore because my kids aren't don't teach me that stuff anymore.
Are you a morning person or a night owl?
Oh my God, I'm totally a night owl. I could stay up all night. I could stay
Really?
easily. Oh yeah, no problem. But I hate getting up early. And I actually went to a sleep seminar here at Stanford, because we're known for our sleep studies. And I said, is there any way you can make me into a morning person? And they basically said, no, that's just who you are. So, I mean, if I have to, obviously I'll get up early, but it's not my preference. My preference is to stay up late, do stuff late, and then, have a little bit of time in the morning to just, get my soul back in order.
Yeah, my husband's the same way. What's a song that always makes you happy every time you hear it?
Oh, ballet folklorico. I love ballet folklorico. And and my husband, that one of the way I met my husband was through ballet folklorico. He's also first gen. In fact, he was born in Mexico, so he's not even first gen now. But he went to Stanford undergrad, and uh, he went to Georgetown Law School. And when I was at Hopkins, one of my girlfriends who went to Stanford with him said, "Oh, I have a friend who lives out there, and he teaches ballet folklorico in Washington D.C." And I was in Baltimore, so I looked him up in the actual paper telephone book because that's what we had back then, and I found his name, and he happened to be just walking out the door to go teach ballet folklorico, and just came back to answer the phone, and that we got together. But I love, and I had been dancing folklorico before, not a lot, but a little bit. And so we still love to try to, dance a little bit, but I love that music. It's just so uplifting and fun and, just exciting to do. And hopefully we still do a little bit of it without getting hurt.
Last question is, what's the best piece of advice you've ever received?
Well, I probably got a lot of good advice over the years that I've, really taken to heart. I told you about my mentor who really gave me a lot of good tips. Um, one is a personal piece of advice, and the other one is a professional piece of advice. So the personal piece of advice actually was from my husband, and I usually don't listen to him. Don't tell him I said that, but he does have a way of, working his magic. And so I was asking, my husband is a very resilient person. He doesn't seem to let things bother him, and he's had a hard life growing up, but he doesn't seem to show that. And I asked him, how do you do that? Because I said, everything bothers me. I always go home and really pour over all the things that I did wrong today, or how could I be better? And I said, you never do that. And what he told me is, he said, Bonnie, you go back and relive all the things that you think you did wrong, but if you forget all the things you did right all day long, and you just focus on the things you didn't do well. And the other thing is, if somebody's going to think something about you, they're going to think about that, and they're going to move on, and you're going to sit there living with that burden for much longer than they are. So don't let them have the privilege of doing that to you. And I thought, oh, that's interesting. I mean, it's easy to hear that. It's not easy to live it, but it is a really important piece of advice. And then the professional piece of advice was from my mentor, the scientific mentor I mentioned to you. And I remember we were working on a project, and some of my projects were field studies in developing settings. I was going out 5 hours into like really unknown territory, trying to make sure that there weren't revolutions. I mean, literally revolutions or other things or outbreaks going on, so I could bring my trainees with me, or just keep ourselves safe. And so these projects were hard to do, but they were fun and challenging. And I remember, just feeling a little down about one of the projects. Just a lot of things were happening that I just, were, difficult to overcome. And my mentor said, "Listen, Bonnie, remember, if it were easy to do, it would have been done already. So the fact that you're working on this question is really probably part of it is that it's an important and hard question to answer. But part of the difficulty is that if it were easy to do, somebody would have already thought of it before." And so, I think I try to think of things that way. If things were easy, we would have found answers already. And if they seem like easy answers, the difficulty may not lie in the solution, but in the implementation of the solution.
Bonnie, thank you so much. It was such a joy to talk with you this afternoon. I really appreciate your time. I know you're so busy, and it really means a lot that you spent the afternoon with us today.
Well, thank you so much for providing this resource. I just hope that it gives people hope and interest in, furthering their passions, and knowing that other people have made it, and that the people like you and your team are available to really help people live out their dreams and the dreams of, making the world a better place.
Thank you, Bonnie. Have a happy holiday.
Oh, you too.